Welcome, everyone. Thanks for joining us today. Today, we are going to be talking about state-level youth advisory structures, and we are very excited to have several of your state adolescent health coordinator colleagues with us to share their experiences. I'm Rena Large from the State Adolescent Health Resource Center, and also I have with me Lynn Brettel, Director of the State Adolescent Health Resource Center. We are a partner in the Adolescent and Young Adult Health National Resource Center. The Association of Maternal and Child Health Programs is one of our partners, and we're also a technical assistance partner for the National Network of State Adolescent Health Coordinators. So we're excited today to bring this conversation to you. We get a lot of questions about state adolescent youth advisory councils, boards, different kinds of structures. There's a lot of information that has been compiled and featured over the years. One of the reasons why we wanted to do this today is to get some up-to-date conversation about these types of structures, and also we're going to take what we talk about today as well as what many of you shared with us in advance, and we're going to create sort of a catalog of state youth advisory structures that we can all refer to and use that for learning and sharing as we go forward. We're going to talk a little bit about some different types of structures, primarily through some examples from your state colleagues. We are going to talk a little bit about other ways that states engage youth if they don't have a state level youth advisory structure, and there are a lot of ways. And then we want to take an opportunity to just have lots of peer sharing. So we have a couple of colleagues with us today that are going to share their experiences from Alaska, Colorado, Kansas, and Rhode Island. But I will also say that there are others who are on the line with us today who have long-time examples or newer examples. And what we wanted to do is just feature a couple of different examples. So we'll have opportunity for conversation later, and you are all welcome to jump in. Really quickly, I just wanted to share some of the awesome information that you all provided in the registration survey. The way that it has kind of broken down is formal state youth advisory councils and boards. All of these examples that we're going to talk about today are managed by the State Maternal and Child Health Program. There are several others that I mentioned that are also on the line that we can have them jump in and share later in conversation as well. And all of their information will be in whatever catalog we're creating after this. There's a couple of states that have employed youth advisors as actual Department of Health employees. That's a really cool example of youth advisory structures. And there's some really great examples of how state maternal and child health programs have funded regional and local advisory structures. And so we have a number of these examples on the phone with us today. And then there's a bunch of other cool things that people shared about how they engage youth through partners when they don't have formal structures of their own. So we have a few examples of those later. Most of the people who replied about their youth advisory structures were engaging between 10 and 25 youth on a structure. A couple of folks said that they had multiple structures across the state, which resulted in 100 or 200 or several hundred youth that fed into state level structures. A number of people also had local clubs that they engaged, and most of those had 4 to 10 participants in smaller local clubs. Most people were engaging youth between ages starting at 13 and 14 years old. A few were starting as early as 12. And there were a couple who were engaging older youth, young adults, up to age 24. So there were some really great examples in what we will be cataloging for you. Recruitment, as you would expect, takes all different shapes through existing partners, through social media, through print and electronic forms, through word of mouth. Some of the youth structures that were shared with us, youth themselves were the ones promoting it with their friends through videos and social media. All of the examples that we're talking about today, and I think all of the examples that we gathered were funded either entirely by Title V maternal and child health block grants at the state level, and or funded by grants that MCH programs manage, like PrEP and school health. And a few said that they had other sources, non-state dollars, some partner funds from the Children with Special Health Care Needs programs, and some of the folks that said that they're funding local structures mentioned mini grants and donations for some of the local work. And one of the things that we attempted to gather this time was how people are compensating youth for their participation. There was a little bit of variety, gift cards, swag, stipends to cover travel or actual costs covered, food provided at meetings. And then a few people shared the range of compensation that they provide for events, either by the hour or by events attended or annual participation, depending on their level, if they were just a participant or if they were part of a planning process. So there's some really good information in the things that you shared. So now this is where the fun actually happens, is inviting some of our state adolescent health coordinator colleagues to share a little bit with us about their work. We have a couple of, the way that we've broken this out is we have a couple of long-time, well-established examples. Audra Bishop from Colorado and Jenny Baker from Alaska fall into that category. They are representing state programs who we frequently hold up as the ideal models, and they've been working on this for a very long time. So we wanted to get their longtime perspective. We also have Sunny Puntavone from Rhode Island. They have just established a youth advisory structure in the last several months, which is really wonderful given the period of time that we're in. So we're going to talk a little bit with her about what that experience has been like. And then Elisa Nerbas from Kansas is joining us in the category of other ways of engaging youth. And she has several things, really cool things that have gone on in Kansas. So she's going to talk a little bit to us about that. So now I will pause and invite, let's see, Audra, are you able to share your screen?
I still can't. So
okay. All right, let's see. Okay, I think we're going to start with Audra, and I'm going to share her slides for her. She just has a couple of slides to share. All right, and excuse my clunky slide presentation. I'm still on a learning curve with, all right. Okay, so I will turn it over to Audra.
Awesome. So thanks for having, it's so fun to see some, I was going to say old faces. I don't mean old faces in that sense. Hi, Jenny. So I'm excited to talk to you all about this. I am actually no longer the person that gets to talk about this stuff very often. My colleague, Lauren Wakefield, is now the state adolescent health coordinator, but she is on maternity leave, having humans of her own, or a human of her own. And so I get to do a guest showing today, I guess. So in terms of our youth advisory structure, we have had our Youth Partnership for Health Youth Advisory Council for 21 years now. It started as a employee of the public health department say, I think we should do this. I think it's the right thing to do, isn't it? And she recruited staff members' kids to be a part of the council. That's how it really got started. And then fast forward, a couple of people had been the facilitator, and then I came in, and my background was really in juvenile justice and residential settings. And so for me, that was where my heart really was invested, of making sure that young people who had been involved in these systems really had a part in decision-making processes that affected them ultimately. So I'll talk a little bit more, I may talk about a little bit more about that in a minute, but we have been really strategic about connecting dots for our state partners around positive youth development and youth advisory councils. And I'll show in one of the next slides, I'll talk about our youth engagement continuum. And it's actually our community engagement continuum, but then we change the language based on the population that we're presenting to. So we have PYD, this is in state statute, that this is an approach that we use in all systems working with or on behalf of young people. I'm not going to go into this because it's not a PYD thing, but we really make sure that the youth advisory council work and our youth advisor work, so the young people that are hired as state employees, are embedded and knowledgeable of this framework, so that when we have people push back, for example, we can say, hey, this is the framework that our state, as not just our department, but our state has committed themselves to. And that is why we need to pay young people as employees, or that is why we pay young people for participation in giving their feedback and recommendations into the policies, practices, and programs that affect them. So for us, it's been really important to connect those dots for other people so that we can be prepared to, we can be equipped to come back to challenging conversations and justify or give the rationale for why we have these structures in place. So I'm going to go on to the next slide. So this is our youth engagement or community engagement continuum. We also use this with our community advisory board, which is a separate entity, but we are actually talking about using or utilizing YPH or our youth advisory council as almost like a pipeline if young people choose to continue, because we have young people that are like, well, now what? I'm aging out or I'm going to college. What else can I do to make sure that I can continue recommendations into either public health or other entities or other systems? So we adapted this framework from the CDC, and this is something that's really important for our youth engagement work, because we help when we're providing technical assistance to our local partners or our other state partners. We really help them decipher, where are you going to engage young people? And so where is meaningful and relevant for this particular project? Where is meaningful and relevant for your particular expertise at this particular time? You know, shared leadership always sounds like the best thing. And we challenge people that it's not always the best thing. And the reason for that is when you're doing shared leadership, a lot of times you only have a small number of young people that you're sharing leadership with. Whereas when you're doing consultation, you can do huge surveys and get lots of feedback from young people. And so what we really ask people to do is to differentiate and diversify their youth engagement strategies across this entire continuum. So not to put all their eggs in one bucket, but really to look at what are the strategies that we can do so that they're sustainable. So if, for example, if we lost funding or our MCH budget got cut and we could no longer hire youth as employees, we wouldn't lose all of our youth engagement strategies with that going away. So we make sure that we're able to be engaging young people at all levels at all times. And that's what we encourage other people to do as well. So the next slide. So this is our Youth Advisory Council, the Youth Partnership for Health. We forever did not really have a logo, and then we had a logo, and then young people were like, our logo sucks, we need a new logo. And so like, you know, engaging community in general, things change and their experiences change and their feedback changes. And so a part of this work is really being able to be flexible and adaptive to their needs at that particular time. And we have multiple young people. I think one of the things that, to go back to the piece of making sure that the quote unquote right young people are here, it's been a big value and intention of ours to not just recruit the young people who come to us naturally, right? The young people who are looking for the letter of recommendation, that are looking for community of service. And when I came in, the first question I asked was, who's not sitting at the table? who of young people who's experiencing the greatest health disparities, and then being able to intentionally recruit from that place. Being really also thoughtful that we're not saving seats for people, right? It's not tokenism, but our outreach became really intentional. So the other aha that we had was that as a state health department, we don't have a lot of connections directly to young people outside of our young people who are integrated, or like who are a part of this advisory board, that we have to connect with the people who are connected with young people, which means from a marketing standpoint, we have to speak their language. So for example, when I first came in, we said our recruitment strategy was something like have a voice in state health, or have a voice in whatever. And from my own experience, a lot of the young people that I worked with did not believe that they had a voice, right? Because they had been marginalized by the systems that they were involved in. So we had to say, and young people created this, but it was, have you had experience as a young parent? If yes, apply. Have you used substances? If yes, apply. Have you been involved in the justice system? If yes, apply. So we called out all of these more traditional, like these risk factors, to tell young people we want you, but more importantly, to tell the adults who were connected to those young people, we want your young people. And we went from very few applications to 60 applications just by that one strategy of calling out who we were actually looking for. And as a result, our advisory council became much more robust. And so when the impact that has, when we had marijuana was being legalized, recreational marijuana was being legalized here in Colorado, we had some, like communications company, marketing company that was doing all of some strategies related to marijuana prevention. And they came to our advisory council and they were like, we know how this conversation goes. It's a bunch of young people that have never smoked weed or marijuana. And I was like, you're going to be real surprised at the feedback you get. And we had a lot of young people who either used or their families used, or, they had a much different life experience than traditional young people that this particular marketing company had engaged. And so it adds a depth to the feedback that they give, right? Because that's ultimately the population that we want to reach. So that was one of the outcomes that we were actually very proud of, and we were called out in terms of the marketing company and different other state departments because of what we were able to contribute ultimately with their different lived experiences. And I think I might have one more slide. I don't remember. Oh, so don't read this slide. This is actually not for you to read, but I wanted to remember that we have this. So one of the things that has been like in these types of conversations, we're asked to say like, how do you do this? Or how do you facilitate? What are all the things that you do throughout the year? And so right before Lauren went on maternity leave, because we had a new staff starting who will be carrying the Youth Advisory Council work forward, she wrote an annual, like, these are all the things that we do throughout the year. In January, you need to start thinking about recruitment. I actually don't know if that's the case, but like you need to start thinking about these things throughout the course of the year. So, and then as a result, she's also created tools. So this is something I'm happy to share moving forward with anybody who's like, what would it look like for the year to facilitate this type of work? The thing that we have found, I think 2 lessons learned. Number one, you have to have a staff that's committed to this, right? Because young people need relationships. We all need relationships, especially right now. But young people, they open up to the people that they trust. So if you want really robust feedback and insight about the lives of young people and what they need, having a relationship and a person that facilitates that relationship is really key and is responsive to their needs. And the other thing that's been valuable for us is diversifying our funding. So although Maternal and Child Health Block Grant funds the position that facilitates this, we have reached out to other partners internal to the State Department to say, hey, put your money where your mouth is. You're interested in getting feedback from young people. And it also, and because of they're now contributing money every year, it also creates a level of accountability. Number one, that they access it, right? So they're getting feedback and they're, and then we also have the expectation that they come back to the Youth Advisory Council and say, this is how we used it. And because we've created that level of accountability, now young people in the advisory council are saying things like, well, how are you planning to use this? And when are you going to come back to us to show us how you use that? And so it puts, the expectation that you come back and you actually do something with this. Don't waste our time. And it's a fun thing to see. It's intimidating for a lot of adults who are not used to young people having some power, but it's also really exciting. So we have some resources. The next slide, I think, is just resources, and then I'll be quiet. So we have our Colorado's PYD in Action website, and that has kind of how we frame positive youth development, examples of it. I don't know if everybody has access to the training materials, but that's something we are happy to talk with folks about. We have a YPH website, so it gives some recruitment materials, community partnership principles. So these last two resources are from the Colorado Equity Alliance, and we're adapting them for MCH as well. So I can share those adapted things, but these are also really good ways to institutionalize. For those of you that are new on this journey, it's so valuable to institutionalize this mechanism of community engagement. And so these are some ways to be able to do that and speak language and help create policy to make sure that people are invested in this. And there's the expectation that you actually access community, i.e. young people, in this case, feedback and recommendations when we're developing things. So I'm sure that was my 10 minutes, and I know I talked fast. So thank you, and I apologize.
Thank you, Audra. That was great. For other folks on the phone, just know that some of the more basic logistical stuff, like the links to things that Audra has shared and some of the, information about the description of the youth partnership, will include that in follow-up, but we wanted to get some sort of big picture lessons from Audra. So I'll pause for a second and see if there's any questions for Audra. And forgive me if you typed something in the chat, I couldn't see it when I was sharing. So you can feel free to type in chat now, or you can take yourself off mute if you have a question for Audra.
There was no questions in the chat box, just lots of thank you and amen kind of comments to what you were saying, Audra. So thanks for sharing.
Excellent, thank you.
Hi, Audra, this is Rosalind from Oregon, and I had a question. I think earlier someone had said that you hire young people as your staff advisors in Colorado, and something that we've just struggled is just working and trying to figure out how to write that position description within state government where age becomes an issue or whatever that may look like. Can you share like a position description for those positions or some sort of draft of something like that for the job?
Yeah, I'm happy to. We actually, so I think most things, especially in this world, it seems like you take baby steps. You like do something to get far, what feels like you're pushing, challenging the bar, and then you do a little bit more. So yeah, I have the current job description, and I will say that we're going to be revising it. So around age stuff, like we had to call it a community worker. And that was the classification for our position. It no longer makes sense whatsoever, because originally it was you reach out to young people, but now they're really doing a lot of consultation and infrastructure development. So, and we've talked a lot, I mean, we're also, as an MCH program, we've prioritized racial equity. And so we've also said, okay, from an equity standpoint, our young people make significantly less than our adult employees, and yet they're doing pretty much the same thing in terms of consultation. So in the next 6 months, I'll be rewriting the position description. So I'm happy to share our current iteration and then our future one as well.
That would be great. Thank you. Any advice or support? Because I feel like those are the pieces that we talk about, like similarly what you're talking about is like pay equity and age and trying to work within the bureaucracy too. So yeah, thank you.
Yeah, and the last thing I'll say about that is it feels like we had to do a lot of playing the game of saying, like, it used to hurt my soul to use the phrase that the HR kept saying of like, oh, this is an opportunity for young people. And we're like, no, it's an opportunity for us. But that's what we had to say to get it approved. And so we were like, it's an opportunity for young people, building the public health pipeline. And that is true, but that wasn't what we were leading with. And so it was a lot of doing that kind of stuff and figuring out, what hill are we going to die on in terms of like being able to fight this fight to get young people valued in the way that they need to be.
Yeah, that's great. Thank you. I really appreciate that insight.
Thank you. And I will also mention that Virginia has a recent example of hiring youth advisors as employees, and Maddie in Virginia did share something with us, a description that they used for hiring, and we can share that as part of our follow-up as well. And I think I saw Maddie on the participant list, so maybe she can jump in later to share. Excellent, thank you. Well, if you have additional questions, keep typing them in the chat or write them down and we'll get to them. And next, I would like to invite Jenny Baker in Alaska to share with us. And Jenny is also sharing an example that has been in existence for a long time. And so we love to go to Jenny with all of our technical questions, and we appreciate that she's here with us today to share about the Youth Alliance for Healthier Alaska. Am I right? Okay.
Awesome. Audra brought so much richness already into the conversation, so I'm going to try to fill in the blanks of what may be different or what she may not have said, but I feel like a lot of that has already been covered as far as structures and the idea of policy and bringing that in. We have not in Alaska been able to do that and bring in legislation to legislate that youth are worth engaging. So I think that is definitely a piece that I wanted to speak to too, is just the challenges that come with always having to have your reasonings in your back pocket, whether it be quotes or stories or data that shows that engaging youth is important and benefits health overall. I also think that it's very important to think about our age ranges and how we engage youth. And I think over the last few years, we've realized more and more how challenging it is to engage rural youth. And because this is a statewide advisory team, we often completely miss out on rural Alaskan youth, especially during the pandemic, because there's been such terrible access to internet. And travel's been cut off. And so, how do we engage youth? So our partners with First Alaskans Institute or our partners with Elders and Youth Conference, where they are engaging youth and just ensuring that we're supporting supportive adults at this point too. I think that's been really helpful. Just overall basics as far as YAHA is concerned, we moved to start including youth 18 plus this year, so 18 to 24, 25, as mentors, and also as when we're talking about topics that focus on young people that are 18 plus, especially healthcare issues. And we are fully funded, not by any maternal child health block grant funding at all since the inception, but specifically by Division of Public Assistance, Temporary Assistance for Needy Families funding. And we've been lucky enough to have that partnership for about 14, 15 years. As far as recruitment goes, we do a significant amount of work on recruiting with school administration, Department of Education, social media. Our youth members are encouraged to recruit to people that they know, if not to be a member or apply for YAHA, but to share on their social media and Instagrams and to kind of get that moving. We also work with feeder organizations like Health Occupation Students of America, Biomedical Careers Academy, Volunteers of America, and seek out smaller grassroots like youth-led organizations like Youth Homeless Connect, and not to bring them in as members, but to bring them in as instigators or infiltrators or people that we can work with directly, as opposed to having them be a direct member. So it's like a member program. And so that we also this year started to develop a high school public health program. So a public health club So for Youth by Youth Public Health Club. And so that's something that we thought we could patent, or not patent, but like put a boilerplate together and share with other schools. And so that would be a feeder entity to do other statewide public health work. And that diversifying kind of opportunities for engagement too, not just as like youth members, but as mentors or peer supports or ambassadors or board members, where there's, you know, it doesn't have to be a direct membership. And although in the past we have been strict about application and all of these different pieces and how we engage youth, we've had to become more flexible and think about compensation in the form of what youth need. So it's been anything from school credit to volunteer hours, to letters of recommendation, to gift cards for active participation, or even buying them groceries or helping them have a month's rent. Some of these things are just pieces that we've come into challenges with because we're not allowed to pay youth directly unless they're an employee of the state. And we do this year have a college intern, long-term non-permanent position, which we have been just super excited about. Our intern this year is a college intern level 3. And Evangeline has been doing a lot of really great work of youth engagement and support. And this year in particular, the level of communications has greatly increased. So we do Remind weekly check-ins, we have our monthly meetings, and then we do coffee chats on the subsequent other weekend. And I think the important piece too is not just the like you're paying for work, but that relationship communication where we're integrating some of our work with their supportive adults. And I'll talk a little bit about that too a little bit later, but the idea of recruiting and getting a letter of support from their supportive adult and then connecting with that supportive adult so that they're aware of their engagement in YAHA and finding out if there's any other ways for us to support them, not just directly with compensation, but to support their supportive adults and making sure that they stay connected. And so that's been a little extra work, but so much more valuable. You know, for instance, one of our members this year became pregnant and lost her housing. And so there was a lot of disconnect between her and her organizations, which she was a leader in before, and being able to take that moment to like, even though it's not directly something that we've funded to do, but paying for her groceries for one day and making sure that she has links up for applications for housing. So those are just pieces of just really supporting youth in their structures and not just expecting them to show up if they're homeless, or not just expecting them to show up if they're dealing with substance use. I think that's the challenge too. And maybe, Audra, you have some other suggestions on keeping youth that are struggling with those things still involved and supported. And I think that's where, you know, the equity piece is just so challenging this year, is that it takes time and energy to support youth. And it's not just like, hey, show up to work, because some youth can't just show up to work. The other piece that I wanted to talk about within the structure, especially the way things have changed this year, and I can drop it in the chat too, was how we dealt with COVID mitigation. And this year we did have I'm not sure if I can drop it in the chat, so maybe I can send it. But we were able to do an in-person orientation, and we did all of the CDC measures for cleaning, and we had everything outside. So thank goodness the weather cooperated, and I've had experience with outdoor recreation therapeutic camps. And so it was easy for us to transition from an indoor setting to an outdoor setting where we were all masked and socially distanced. So just kind of thinking creatively about how to make those situations fun and not to be so focused on that they can't travel or that they can't do that and we have to do everything on Zoom, but to really think creatively, even though you feel like you're inside of a box. The other piece that I think has been really great over the last few years is this the opportunity to do a little bit more research and to understand cultures and diversity a little bit more, to understand equity, to help youth move from tolerance to acceptance to respect. And those conversations have been challenging and difficult, but at the same time, like Loretta Ross, who like practices radical acceptance and radical love. When you have people that have diverse opinions and divergent opinions, especially in a culture now where there is quite a bit of call out culture, that we're asking youth to reframe what they're thinking and to call in. And if it's something is blatantly disrespectful, to not become violent with their words, but to also help them understand the other person a little bit more, but then also set up boundaries that create a successful environment for young people to work together in. And that has just been, I think, the ultimate challenge, but otherwise we haven't been doing that as much in the past. And I feel like that has been a deficit of the things we've been failing at as a statewide youth group. So yeah, anything from youth that live in poverty or youth in rural communities that like can't gather in the summer because they're at fish camp, to youth that don't want to engage with someone that's an atheist, and being able to come together and have those conversations and talk about how our mutual respect can influence health. Yeah, I think the last part I just wanted to say was just not forgetting evaluation and understanding especially for the adults that are starting this work, to self-eval for your readiness. And the Ford Foundation put together a really great link or a packet that has some of this work already in it. There's so many resources out there, but I wanted to give you 3 that I thought were super essential. One would be the Ford Foundation Readiness Assessment, where it kind of walks you through questions of either your board, like if you're a school-based health center advisory team, like how do we bring youth into this situation? To do a self-assessment first, decide how ready your people are, like if you're doing a youth adult partnership, and then being able to train those folks to build more, to move from tolerance to acceptance to respect. And how do you do that? It's not just a light switch you flip on. So being able to help adults be ready for that. The other piece was a recent publication that the Anchorage Youth Development Coalition put together, and they surveyed all sorts of different organizations and structures across the nation and put it in together as far as a youth governance report. So understanding, like, if you want a youth on a board, and do they have voting rights, and are they able to like have the same responsibilities and membership rights as adults? So being able to look at statutes and see what your nonprofit or for-profit or in-state organizations are required to do. So that's a really great resource. And then the last one I had was our Association of School Boards, readying boards for membership. And it's not just for boards, it's for anyone that engages youth. I think the part that has been the most challenging, or that I have ultimately failed at over the long term, is that I'm in public health and I get paid really well, and I'm a white lady. So our level of diverse leadership is like so sparse in Alaska state government. And so really being conscientious about land acknowledgement and slowing down and letting conversations breathe when I know that I have stuff to get done and action items to accomplish. And that really sometimes it's just about getting to a place where we're building culture of respect and learning from each other. So I don't know if that was filling in the gaps. I said a lot of stuff. Are there any questions?
Thank you, Jenny. And we can.
Yeah, I had a question real quick. Can you say, sorry, this is Megan Moore. I'm filling in for Andrew Youngmeyer in Missouri. And my question was, can you say a little bit more about supporting the adults who are supporting the youth and kind of what that looks like?
Absolutely. So there's some really great work that has been done through Brightways Learning Kaleidoscope. And although it's a training you have to pay for, but it talks about the details of behind why it is that some youth don't necessarily want support automatically, and how to be a supportive adult, and how to support yourself, and how to be emotionally resilient, and to kind of Q-tip it, like, don't take it personally, quit taking it personally. Youth are going through changes too. And so that and actual positive youth development training, and getting connected with organizations like Anchorage Youth Development Coalition, if you have something like that locally, or like Audra was talking about their trainings on positive youth development. And there's a little bit more of a statewide commitment there, but if you have local organizations that are willing to train on that, then not just getting the supportive adults and teachers that are supporting youth that you're working with trained, but making sure that they know that you're all on the same page with what their goals are. Even if it's a brief conversation with them at the beginning of the year, be like, what do you really like about youth, or the youth that we're working with? What's something that you find that's really important, or that's on their goals, or what's something that they are passionate about? Just so you get on the same page with that particular supportive adult. And then keeping them in the loop with like emails at the end of the year, letting them know when we're recruiting again. And then when they do something spectacular, or even like a quote that they said in a meeting that they're willing to share, sending that to their supportive adult or their parent.
Awesome. Thank you so much.
Yeah.
Thank you, Jenny. Are there other questions for Jenny? I think we could probably spend several hours talking about every example that we have with us today. And there's a lot of logistical, technical things that we can share, links to the Youth Alliance in Alaska for more information. But I really appreciate this kind of conversation, because I don't think we get to this level of like, how do you really engage youth, and especially the whole conversation about meeting their needs, not just expecting them to show up. That's something important that I don't think that we get to that level of conversation normally. So continue to pop questions into the chat box, and we'll have time for more discussion. I would like to invite Sunny in Rhode Island to talk a little bit about the effort that you just launched last year.
Thanks so much, Rena. And thank you, Audra and Jenny, for sharing your experience and expertise in leadership. That was definitely a lot of good aha moments for me as well. And definitely like, we're just getting started, and definitely like learning from what some of the things you said, and already encountering that as we are just launching our efforts right now. So in Rhode Island, we recently launched what we call a Youth Health Ambassador program. It's only literally a couple of months old. In Rhode Island, we've had previously and still have a youth advisory council that's administered by our Office of Special Healthcare Needs. They had really started with a youth advisory council to help plan like an annual conference they had, and certainly have expanded membership beyond that. But we recognized in our adolescent health program a need for some additional support and more platforms to offer youth the opportunity to work with us, and for us to work with them. We kind of continually would hear certainly the need for youth to be at the table with us, and we understood that, but it was something that we were trying to think through and see kind of the challenge of, just inviting youth to the table. We'd sometimes have community partner meetings, and they're like, where are the youth? Like, we absolutely want them to be here, but also like, we want them to feel comfortable and prepared to engage with, a group of professionals if that's what we're asking them to do. So that's kind of how our Youth Health Ambassador program came to start. We really wanted to encourage our also other public health program colleagues to really think about youth as partners, to the points that, Audra and Jenny are making about really that positive youth development model, and thinking about youth as genuine partners in our work, similar to how we work with community partners. And I think in Rhode Island, especially, we've done a lot of work as a health department to really move forward how we engage with community members, community professionals, but youth have never really been as much in that conversation. So for us, we really wanted to think about that really more authentic, intentional, proactive approach to youth engagement. I think we were all pretty used to kind of that kind of what is probably more of a tokenist approach to youth engagement, which is, here's this great idea that we have and we've worked on it and it's like 95% done, and let's run it by some youth and ask for their opinion. And that's, it's still a worthwhile thing to do, and certainly want people to still do that, but we wanted to think about encouraging that youth engagement as early as possible in the process. That, similar to how if we're doing a needs assessment for program planning, we would engage community members. If we're planning things that will impact young people, we need to be able to have them at the table and be partners with us through the process. So for us, our Youth Health Ambassador program was really trying to build a relationship with a group of young people who we could provide foundational knowledge about public health. So they understood what the health department does, what the health department is, what kind of our different approaches are to public health. So, I know, for example, like in public health, we get really comfortable using acronyms and talking about, for example, even just using the framework positive youth development, like what does that mean? And making sure that when our youth become not only experts in their lived experience, which is, certainly the value that they bring, but then also that they have some knowledge base and expertise in public health as well. So that when we're asking them to sit at the table, they can feel like they can do that as comfortably as possible and really give them the opportunity to also build their leadership skills. So that's kind of where we started. We had been working on this for a number of months, and in these COVID times has been a little bit more challenging, but we had an open application period that was really just us sharing through community partners, through our social media, through the Department of Health, really showing it through schools and asking them to share it through their networks as well. So with that, we got 80 applications, which was fantastic. We really wanted to make sure that we were really thoughtful about how we, invited the youth to join us at the table. So we offered interviews to everyone who applied. We had around 55 youth who were interested in moving forward and with an interview. We had our adolescent health team kind of cycle through the interview process, so they weren't overwhelmed by a large number of people asking them a myriad of questions. And our questions are really honestly a little bit more like, what are their interests, telling us more about them and their lives and like what their interests are, and not really anything super specific about too much about what they're looking for from us as well. So we really wanted to know them a little bit more, what their how they could potentially work with us and what their interests were, and things and understanding the skills and talents that they bring as well. So that was really the goal of our interviews. In the end, we invited a leadership cohort of 15 youth to join us in our Health Ambassador program. And honestly, through the interview process, it honestly just made it more difficult for us to narrow down to 15, but 15 was like the manageable group size that we felt like we could handle. But as an offshoot of that, what we're trying to do, and why we've kind of like reframed this as what we call our leadership cohort, is these are the youth that we're going to work with on a routine basis. We're meeting with them twice a month, but for them to help provide the leadership of how we build out other youth engagement opportunities and how we can really engage other youth who not only express an interest in working with us and, bringing their experience and their expertise, but also thinking about how we reach other young people. I think, we found in this process too, because we kind of just left it as an open application period and didn't do really targeted outreach. And that's something that we realized that we really should have done more thoughtfully, and we were kind of on a time crunch because we really wanted to launch this in 2021. that we are really trying to think about how we do a little bit more targeted outreach to engage more youth who maybe aren't participating in our leadership cohort presently, but then have other kind of ad hoc youth engagement opportunities. And that's kind of what we're building from here. And our goal is really, as much as possible, and to introduce this to our Department of Health colleagues, like I mentioned, to really get them to think about youth as partners who we should engage as we would any other partner in the process. We very readily reach out to, professionals. We very readily are thinking about how we engage like community residents as advisors, but how do we make sure we treat youth in the same way and we partner with them in that way? We are trying to find ways to reimburse them. It is a little harder for us to employ youth in our process, but we are planning to give them gift card reimbursement and stipends based on what their interests are and what they indicate they want from us. And we are trying to think about different ways to fund the program. So currently we are also trying to solicit funding from other programs to try to also get them engaged in the process. So not a lot of money, but like most programs can spare $500 out of their budget, but if you get it from enough programs, they can see why they want to invest in this group and why they want to make sure they're engaging youth leaders in their program planning as well. So that's really where we are. We're very much in early stages, so really like looking forward to learning more from everyone that's been, farther along in this process. And really also want to acknowledge my team, who I think is also on the call, Ratha, Elena, and Lily. And Lily is newest to our team and has really helped take a strong lead in helping us coordinate this project as well.
Well, thank you. That's really great. And the fact that you were able to launch that, to continue to move forward with it in the last year is really amazing. Are there any questions? No, we can keep adding your questions in chat or writing them down, and we'll come back to them later. We'll look forward to hearing how that rolls out in Rhode Island. Now, before I go on, I just wanted to share one thing which I had teed up and I forgot to share it, and that is Jenny shared this in December from the, the Youth Alliance for a Healthier Alaska. And I don't know if this was part of the outdoor event that you mentioned, but I really loved this. So I just wanted to share it with you. Thanks for sharing that, Jenny. So now I would like to invite Elisa in Kansas to share a little bit about what they've been doing. They have a number of things going on. And Elisa, do you want me to share your slides, or would you like to share
If you
them?
could, please. Yes, that'd be great.
Okay. All right.
Good afternoon, everyone. My name's Elisa Nurbis, and I try to make some things where, where we come to discuss and brainstorm together. However, I am not just the adolescent health consultant, but I'm also the child health consultant for Title V. And so I wear multiple hats, and I'm a team of one, but I have lots of partners that I ask favors of. So I love that we're having these peer sessions. I'm so glad that I could join and be a part of sharing some of the things that we're doing, but also listening to all these great resources and ideas. Ever since I came on board about 4 years ago with Title V, it has been my passion to bring the youth voice and engagement and shared leadership, to the state. And that's been, I quickly realized that that there was a lot more to it, and the road was not so straight, and not everyone shared my excitement necessarily with that. I think they enjoy, you know, having youth perspective, but I try and push the bucket a little bit and try and get us sort of thinking outside of the box. So I will say the last couple of summers we have had college interns that I have worked with that have done wonderful jobs. And I think that's kind of started our leadership to think, oh, this is a good thing. And maybe we'll revisit that or think a little bit more about bringing more adolescents on board. And so I really shared with them the desire to make sure that youth and adolescents were apart from the very beginning. And this was perfect timing because, of course, we have our 5-year needs assessment block for the block grant. In 2019, we started. And I contracted with an organization, it's called DECA. And don't ask me what the acronym stands for because it used to stand for something and now they just go by DECA. So it's just DECA. But they do a lot of drug-free task force. They have a lot of youth leadership. They do like the distracted driving. They have the SAFE program where it's teen led and peer educators on safe driving. They also work with foster care, family preservation, and that sort of program. So we wanted to contract with someone that was on the ground that had some trust with youth because they have satellite sites throughout our state. And so we thought that they were the best partner to help with this project. I did share with them that I wanted in-person focus groups, but also an online component. And the initial ask was that, so if you think of the state of Kansas, it's right smack dab in the United States, and it looks like a really large rectangle. And we separate it into 6 regions when we're talking about public health. And so I said, I would really like feedback from all 6 regions, at least 2 focus groups for each region. And really, and I kind of threw these slides together, so targeted populations really probably wasn't the best terminology to say, but I wanted to be intentional about, yes, I wanted all youth voices, but there were some youth voices that we had never really captured, and I wanted that opportunity to be available to all youth from all backgrounds, all experiences. I really wanted a cohesive representation. So I did just provide them with, encourage them that we did want to hear voices from youth and young adults in the foster care system, juvenile justice system, the LGBTQ, and then the Black, Indigenous people, and people of color, special healthcare needs, and English as the second language. And they did that, and they far exceeded my expectations. There was actually 19 in-person focus groups, and there was at least 2 in each of the 6 regions. Some had multiple. We also had 34 youth complete the an online survey, which had exact same questions, very open. They could just write what they felt about the various health topics and where they went to get their health information and who they went to ask questions about health. And then we also had another component where we offered individuals to submit photo voice documentation, take pictures, tell us what the picture means to you, what does your community look like, What does health in your community look like? And we had 4 groups that worked together, multiple youth. There were 2 school districts, 1 FCCLA chapter, which is a club in schools for family career consumer leadership of America. And then there is a Young Women on the Move group that also participated in that. We did put together a slideshow, and I put the link there in the slides if you're interested in viewing that. So we got all this feedback from over 200 youth, and from their feedback, then that's what we used to create some of our adolescent priorities and strategies. So Rena, if you could go to the next slide for me. So as you can see, there's our priority 4, our main message is that adolescents and young adults have access to and utilize integrated, holistic, patient-centered care to support physical, social, and emotional health. A long-winded statement, but because of all the feedback, we got some quantitative data, but the qualitative data, the stories, the experiences that they shared with us was just extraordinary. And so what we learned from these groups was that, the first people they go to if they have a question or a concern about health is their peers, right? Or they look it up on Google or whatever browser they have available. Sometimes they go to, an adult that may not have trustworthy quality information, to share. And so they said, we don't know where to look. We don't know who to ask. Sometimes we're scared to ask, so we'll ask our peers and they don't know. So we try to figure it out together. And I said, well, what if there was some resource that took all of the main topics that you guys talked about, all the main concerns that were brought up in the focus groups, and we gave you little tidbits of information, of quality health messages, and then we provide you with quality and trustworthy websites and web links, and it would all be interactive, and you can have it in your phone anytime you need it. They were like, that would be great. That would be great. And they really loved the focus group. They asked for more. They said, please come back. We want to talk more about health. So we know that there's a desire out there for youth to be engaged and to talk about what's going on with their bodies, what's going on in their environments, what's going on with their lives. And so that's where our strategies came with, that we would, again, go back to the youth and keep asking them, is this what you're looking for? We put all your topics in this document. Here's the websites that we found. What do you think of this? And it went through a lot of modifications because they would come back and say, oh, that's cheesy. That's not really what we were thinking about. So it went through a lot of modifications. But we do now have this guide for youth. So they were a part of the whole development. And here in a little bit, I'll talk about how they're going to help us spread the word about this document. But we also, they didn't know what resources were in their community. And so and we talked a little bit about the 211 system. And then also in Kansas, we have something called 1-800-CHILDREN, which is a statewide directory of each county's resources, very similar to 211. So there's two resources. And so we're really going to work with the youth that we brought along on this journey to bring awareness and promote. How do we promote these things so that youth know to go and make calls and figure out what they have in their community? So next slide, please, Rena. So here's the youth guide. And we actually put in our acknowledgements that, this was based on all the feedback we got from the youth. That's what the red circle is. I highlighted in the electronic document that this was based all on youth feedback. These topics that are in the guide were the ones that were raised the most in our focus group discussions. And as you can see, these are things that they're all, they're all concerned about and worried about, or that they've had questions that their friends have asked about. And so each component then, of course, has little snapshots of tidbits, links, games, quizzes, all sorts of things. Okay, go on to the next. So then we talked about, how are we going to get, we have this tool, and I'm always like thinking, man, we create stuff, but is anybody using it? Is anybody looking at it? How are we going to make sure that it's making an impact, that we're getting it really out there? And so again, we went back to the youth and we said, tell us how to get this into your phones. Tell us how to get this into your hands. And so we had them design a whole marketing campaign called Why. And so the why is actually a question, but also an answer, because it stands for Whole Healthy You. And so they thought of they were starting to think of all different kinds of questions that start with why that would link to the different sections. So the example you see there is, why isn't scrolling TikTok exercise, right? And so there were some that are a little bit more difficult. When we were talking about mental health and stress, we tried to make them funny, but it's a serious topic. So, but we didn't do anything until it got their seal of approval. So again, a lot of modifications happened. We kept going back to them and saying, is this what you want? Is this what you're looking for? We have a total of 3 videos, but some of the youth that helped us are actually actors in 2 of the videos that we can use for the social media campaign. They thought of the colors, the letters, how the letters looked, all the logos, the social media images, everything was, they participated in. And it was really us just trying to create it and go back and ask, if that's what they wanted. So once the Why campaign kind of came together, we wanted to really make sure that it went out to the whole state. And so I sent out a survey form to as many state departments, as many coalitions that I knew about, and then told all of them, send this out just to see if there was any interest from others who worked with youth, if they would be interested in partnering in this campaign with our group of young ambassadors. And we got 60 agencies. Now, part of that interest form talked about, how are you going to engage youth? Are they going to be consultants? Are you just going to give this to them and have them send it out through your social media? And we did get a variety of answers, of course. And so the ones who are really going to have the youth do be the spokespeople and really push this out, we're doing a couple extra things for them. And then the last slide, Rena, if you want to show that. Another thing that is being integrated into the Why campaign is, I also sit on a few state boards about youth suicide prevention, and we're having a youth suicide prevention art contest. So this is about any creative medium that speaks to youth. It can be poetry, it can be music, it can be art. And they're going to submit it to our state suicide prevention resource center. They have a website here. There's going to be a gallery with all the submissions. So they'll get a little bit of notoriety, I guess, having their artwork on there. And we do have youth that will be judging that have chosen not to participate in the contest, but they will be choosing, helping choose the top 3. And it's for grades 6 through 12. There will be gift cards to the top 3 for each age group. There'll be swag bags, but they're also going to get a certificate and a letter from 2 of our state health secretary, or our health secretary, and then our secretary for DCF, which is our family preservation, or it also holds the abuse hotline, but also our behavioral health. So one secretary, is the head of 2 departments. And so we're going to use some of those submissions, and we're going to use that as part of the social media campaign for the mental health component and the suicide prevention component for the Y campaign. So it really all is about the youth creativity and their decision making through this whole process. So that's all I have. If you have any questions.
Thanks, Elisa. There's a lot of examples in there of engaging youth through other structures, through partners, and there's a lot of that going on in examples that you all shared. Are there any questions for Elisa?